Doc, come on, I mean, I know I'm supposed to eat better. How much does it really help? One of the things that I actually see a lot with patients is that, well, me being a foot doctor and me being a podiatrist, I deal with a lot of pains. And one of the questions that I get most is, Doc, come on, I mean, I know I'm supposed to eat better. I know I'm supposed to eat better to be able to remove the pain, but how much does it really help? And I get that questions a lot. I know you're a nutrition specialist. I know that you have a very vast amount of how to eat better. So let me ask you something, Doc. Is that really that different?
Yeah, so eating healthy matters so much. Again, eating is one of the pillars to health besides sleeping and breathing. So nutrition is, again, one of those pillars that I highly recommend patients look into in terms of improving their health, no matter what types of conditions they have.
One thing that I'll say though is that when I see patients with the same amount of condition, same type of foot pain, same type of ankle pain, and I see a lot of patients, so I get to see patients with a similar type of severity, similar intensity, similar location. Some person gets better really fast, some people are struggling to get better. And I personally really think that comes down to what we eat and then the ability to be able to get the swellings out of their system. How much do you think is true?
Yeah, it's very true, right? So when I tell patients, this is what you should eat and this is what you shouldn't eat, think about it this way. So whatever you're taking inside your body, it's going to either help you decrease inflammation or it's going to help increase inflammation. So if you make it really black and white, it's so simple so that they can have an idea that, okay, these meals I'm eating over the course of the day, it's actually helping me improve in the long run, rather than, okay, these meals are actually worsening my condition in the long run. So that's why eating healthy for a long term to start with is really beneficial for any types of condition, no matter different types of severity or the same severity.
You know, one thing that I'll say is that one thing that I always tell my patient is, well, number one food that you really want to avoid when it comes to getting the proper nutrition and healing your body and making sure the pain does not linger in your body is avoid processed sugar. Like, I love chocolate. I mean, I have to really admit, I like chocolate. I love milkshakes, and I do understand all that. But every time I eat chocolates or have a milkshake, my body just aches. So I usually tell my patients to, listen, try to avoid processed sugar. And that's number one thing that I always tell my patients. You agree, yes?
Yes.
Is there any other thing that you can think of that patients should avoid eating when they are trying to get out of pain?
Well, same thing with processed sugar, any preservatives, right? And another saying that I like to tell patients is that the longer your food lasts, the shorter that your life will be. So the preservatives in processed foods, especially any packaged foods, they're highly toxic for the body and they, again, accumulate. So they cause further inflammation. So it's one of the things that we don't look at in terms of like the ingredients list on the package because their names are so long. So that's why I highly recommend eating a whole foods-based diet, so fresh, live foods rather than packaged foods, because those don't have any preservatives at all, and they make you live healthier, get your weight down, lower inflammation, and just make you overall healthier in the long run.
Okay, I know not everybody comes out of factory. Well, nobody comes out of factory. Everybody comes out in different shapes, different sizes. Right. People have different problems. People have different diseases. People come in different shapes and sizes. So I want to be able to ask you, are we able to personalize their diet plan and help them get out of pain?
Yes, and that's one of the things that I specialize in as a functional nutritionist. I look at every person as an individual. So it doesn't matter if you have the same pain in the same location at the same severity in your body. I look at each person based on their own unique biochemistry, their own unique lifestyle factors, and I customize a personal nutrition plan long-term for their needs. So they might have a different diet, they may have a whole set of different food lists to avoid or not avoid, and they might have a whole other lifestyle factors to consider based on where they're at that moment. So I highly recommend personalized nutrition because that is the fastest and most effective way to getting your health back on track.
Okay. So to summarize, right? Avoid processed sugar and avoid any processed foods.
Right.
Longer your food lasts, shorter your lifespan will be.
Exactly.
So shorter your, so shorter your food span is, longer your life will be.
Exactly.
Okay.
Yeah.
Good.
Yeah.
Wonderful.
Well put. All right.